Hello and welcome to vlog number 115. This week I went to the National Hospital for Neurology and Neurosurgery to see my London neurologist so that she could assess my condition and the effectiveness or otherwise of my deep brain stimulation, or DBS. I have actually been struggling with my voice for about 18 months now and hoped that my appointment would result in some sort of review of the settings of my neurostimulator to see if my speech problems could be alleviated. To this end, I had been in contact with the DBS nurses, whom I regard as being the experts in the programming of the DBS hardware, to ask them to see me prior to the appointment with my neurologist. Unfortunately, I was denied access to the team on the basis that I would see my neurologist on that day, and my neurologist would make any adjustment that she deemed necessary. Okay, the adjustments made by my neurologist on my last appointment weren't exactly helpful, but I'm prepared to give her the benefit of the doubt. My appointment is fairly brief and does not result in any changes to my DBS. I tell my neurologist about the issues that I'm having. She looks at the settings of my neurostimulator and tells me that my stimulation is set very low, and as such, she doesn't seem to believe that my DBS is responsible. More likely that it is due to disease progression. I'm slightly taken aback that she doesn't know which medications I'm currently taking for my PD. And she is slightly taken aback when I tell her that the only medication I take is cannabis. She raises her eyebrows at me, so I tell her that it is more effective than any of the traditional medications and doesn't have any of the nasty side effects. She is sceptical and parrots the usual anti-cannabis arguments, saying that it has serious side effects, causes mental health problems, and offers her opinion that it will never be available on the NHS. I ask her to put her money where her mouth is, but she declines, telling me that she's not a gambler. End of that topic, I'm afraid. She does remember that I asked her about exenatide last time I saw her, and I remind her that Norman Lamb wrote to her recently to ask her if she would be prepared to submit an individual funding request on my behalf. She tells me that she has passed Norman's letter to a pharmacist and that she will chase this up next week. She seems fairly keen for me to try this medication, so I remain hopeful that something will come of this. She offers to see if the DBS speech therapist is available to see if he can offer me any advice on my speech issues, so of course I agree to that. Luckily, the speech therapist is available and willing to see me immediately, so I part company with my neurologist and walk upstairs to his office. The speech therapist sticks a microphone under my nose and gets me to talk so that he can listen to and analyse my voice. After a few minutes, he tells me that he believes my problems are caused by the stimulation from my DBS, rather than the progression of my Parkinson's, which is what I really wanted to hear. He wants to book a long appointment with me, one of the DBS nurses, and one of the DBS team neurologists who has a special interest in speech problems in DBS, with a view to giving my neurostimulator programming a thorough shakedown. If only they had taken the trouble to listen to the patient voice in the first place, then this review could have been taking place there and then, and in fact that's what I assumed would happen. As it stands, my wife will have to take another day off work and we will incur another £100 in travelling expenses. Still, if it fixes my speech, then it will be worth it. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.